Dr. Chris Barnes. I'm a chiropractor here in Tulsa, Oklahoma. I'm the owner of Tensegrity Chiropractic, where we restore balance. So occasionally I have time to make a video about just a cool case. We have hundreds of them all the time, but I thought this one was really unique. But at the same time, also very similar to stuff that comes in a lot. Here we have a middle-aged woman who's starting CrossFit, who's having issues with stress incontinence. So her pelvic floor is not working. She's having issues leaking when she jumps, when she does jumping jacks, when she does box jumps, double unders. She does mention that she has low back pain, especially on the right side, that wraps around to the kind of like underneath the ribs here. That happens every couple months, and it's really weird, and it puts her down for a couple days. She has to take muscle relaxers. But she comes in, she tells me specifically that her glutes and her hamstrings do not fire. Okay, where do you feel that?
In my lower back.
How about your butt or your hammies?
Nothing. A little bit in my quads.
Okay. Oftentimes when patients come in, they're right. This young lady had actually been coached by one of our other patients who's a trainer, and that trainer told her, actually, you should really be feeling soreness in your glutes and your hamstrings because you just did a bunch of deadlifts, you just did a bunch of exercises that should make those areas sore. And this patient said, no, only my back is tight. And that was that was a red flag right there, that yeah, that is true. Maybe these muscles aren't firing. So as you can see, I went in and I tested the muscles in her posterior chain, which are like the glutes, the hamstring, the low back muscles. As you can tell, we've got complete weakness in both hamstrings, complete weakness in both gluteus maximus. I roll over here, we've got a similar issue. We've got weakness in both psoas, which is one of the powerful hip flexors. We've got weakness in both quads, which is actually a little bit more rare. And we do have weakness in the rectus abdominis, or the primary abdominal muscles. There was some other stuff, but those are the big findings. And with those muscles being weak, it would be very difficult for her to do deadlifts or squats or anything else that requires that much core. So what was causing all this? Okay, and I went and I started doing my testing. Okay, and I had her, there's not really like a good muscle test for the pelvic floor because it's a very intimate area. We don't just touch that area. But we can use muscle response testing, which is the muscle testing that you'll often see me do. And that allows me to talk to her brain about, what is the status of the pelvic floor? Is it working the way it should, or is it not working as it should? And I had her hold a Kegel, and it just felt really weird for her. Okay. Now, here's what's interesting. The correction for the pelvic floor, because a lot of women will lose the ability to hold their bladder after having kids. The timeline with her didn't really fit that. Oftentimes it's just we need to adjust their tailbone or do something with their pelvis and they're good to go. Hers was an emotional issue, and I immediately knew it was from her father. And so one of the parts of the emotional correction was needing to deal with that father issue. We worked through some specific things, and immediately when I had her try to hold a Kegel by testing the pelvic floor afterwards, it was incredibly strong. Felt completely different to her. So what was the end result? Okay, well, first we had this problem when she twisted to the right. She had pain in the right side of her back. That was related to her father. As soon as I cleared the issue with her father, she could twist to the right, no pain, she could go way farther, okay? After that, the issue was that, one, we had all the muscle weakness. So I laid her back on the table, and as you can see, I test the back chain, totally strong, hamstrings totally strong, both glutes completely strong. I flip her over, hip flexors are strong, and core is strong. I made one correction to the diaphragm, which locked the core in, and she was good to go. But the correction for the diaphragm was also emotional. There was no muscle cueing, no rehabilitation. Literally, I cleared the emotional stuff from her, and then I literally had her go and perform a deadlift. Good.
I can actually feel my glutes.
How about that?
Totally different.
The comment, the feedback she's giving is she actually feels it in her glutes, she actually feels it in her hamstrings, and way less tension in her back. Completely different. Now, how's it possible that you can go from muscles not working, okay, 1 second to them working normal 15 minutes later? And the magic to that is tensegrity, restoring balance. We can lose balance in our body because there's a tight muscle, a trigger point that needs to be released. We can lose balance because a joint needs to be manipulated. We can lose tensegrity because there's a weak muscle that needs to be strengthened. But oftentimes, more often than not, especially if an issue is chronic and it hasn't been getting help from anywhere else, it's an emotional issue, it's some sort of psychosomatic issue where there's a conflict in the mind creating an issue in the body. And for her, it was dad. And so we just helped clear some of those issues that she had from when she was young. Doesn't mean it changes the relationship with her father now, but in her mind, she gets closure about some of those issues. And now the weakness that was coming from the dad issue is now no longer there. And her pelvic floor is working normal, and all the muscles in her body are working as they should. And now the movement is normal. So oftentimes the reason why we have muscle weakness, muscle pain, continuous issues that come and go throughout the months and never really get better is because they're rooted in an emotional cause. And so that's one of the biggest things that we do here is make emotional corrections when that is necessary. And what's wonderful about that is emotion is so high up the food chain as far as importance in causing pain that when we clear emotional stuff, oftentimes the physical is gone for good. The reason I made this video is just to show that even though you're a 40-year-old woman, you're starting CrossFit, you have issues with stress incontinence, you can't hold your bladder, and you're having pain when you lift, and you're not feeling the parts of your body work the way that you know they're supposed to. There can be something done about that, and usually done within a matter of minutes. So that's what we offer to all of our patients, is to take a good look at you from top to bottom. This is not a 1-minute assessment. She spent an hour with me today, or a little bit longer. But in that hour, we were able to find a lot of the clues, a lot of the issues that were driving the dysfunction, and we made some quick corrections, and she is not the same woman as when she walked in my office today. So I'm really excited to see how she does this week, reporting on her lifting, because I know it'll be a lot stronger and a lot better, but also a lot less pain. And what's nice about not just getting her physical body feeling better, emotionally she's going to feel like a different person too. Okay. How's that feel?
Great.
Great. How's the hips, the glutes, everything feel pretty strong?
Yeah, strong, engaged.
Good.
I can feel it in my back.
How'd you feel this week lifting weights?
So much stronger. I could actually feel my muscles actually firing and flexing.
Was that odd?
Very odd.
Okay.
At first I felt like I was doing something wrong. I was like, no, this is what it's supposed to feel like.
Great. So that's what we offer here in our office. We try to get you to where you feel whole again. And if we can do that, magic happens. Always wonderful doing what we do. Never gets old.